Let's talk about panic disorder. It's one of those things that can make your entire world feel like it's collapsing in a split second. Today, we're going to take a journey from that moment of intense fear to a place of clarity, understanding, and most importantly, management. And we have to start right here. Because for so many people, this is the single most terrifying thought that flashes through their mind during a panic attack. The physical feeling is so incredibly intense, it's easy to believe you're having a life-threatening cardiac event. So, to really get this, we've got to first dive into the raw experience. What does a panic attack actually feel like in the moment? Okay, so here's the formal definition. It's an anxiety disorder, sure, but the two words that really set it apart are sudden and unpredictable. That's the key. It often strikes completely out of the blue, with no obvious warning or trigger. And when it hits, it is an absolutely overwhelming rush. Just imagine, 1 minute you're fine, the next your heart is pounding out of your chest. You start sweating, your mouth goes completely dry, and this terrifying feeling of losing all control just washes over you. It's that specific cocktail of symptoms that feels so much like a heart attack and makes the whole experience so deeply frightening. So what in the world is actually happening inside your body? Well, the best way to think about it is like a faulty fire alarm. The sirens are blaring, lights are flashing, but there's no fire. Your body is screaming danger when there's actually none around. And this really gets to the heart of the fear, separating what it feels like from what's factually happening. In a panic attack, your body's fight or flight system just goes into overdrive for no real reason. The symptoms, yeah, they're super alarming, but they aren't life-threatening. A cardiac event, on the other hand, comes from a real physical problem, like a blockage in an artery. One is a false alarm, the other is a true emergency. You know, it's fascinating to see how one physical symptom can set off a whole chain reaction. It often starts with hyperventilation, that rapid, shallow breathing. When you do that, you're actually blowing off too much carbon dioxide. That drop in CO2 literally changes your blood chemistry, which then reduces the amount of calcium available to your nerves and muscles. And what happens then? They get overexcited, leading to those really frightening muscle cramps and spasms, especially in your hands and feet. Now, it's important to know that panic disorder rarely exists in a vacuum. It's often tangled up with other conditions and risk factors that help paint a much bigger picture of what's going on. And here is that bigger picture. A really common companion to panic disorder is agoraphobia, that fear of being in places where you feel trapped or can't easily escape. It's basically driven by the fear of having a panic attack in public. Beyond that, these attacks can be linked to depression or even underlying physical issues like an overactive thyroid. And of course, lifestyle stuff matters too. Things like caffeine can make attacks more frequent, and for some people, cannabis can actually trigger them. Because the symptoms can look so much like other problems, you can see why getting the right diagnosis is an absolutely critical first step. And the very first thing any clinician has to do is rule out any physical or organic causes. I mean, before you can diagnose a panic disorder, you have to screen for things like thyroid problems or actual heart conditions. You just have to make sure nothing serious is being missed. So when does this usually start showing up for people? Well, there's a pretty clear pattern in the data. The disorder most commonly begins to appear when someone's in their mid-20s. This chart does a great job of showing what makes panic disorders so unique. See, a person can have a panic attack as part of another anxiety disorder, like social phobia. But in that case, it's usually tied to a very specific trigger, like, say, public speaking. But with panic disorder itself, the vast majority of the attacks are completely out of the blue. They're sudden, unpredictable, and happen no matter what the situation is. Okay, so we've looked at the fear, we've looked at the biology. Now let's turn to the most important part of this whole conversation, the hopeful and really effective paths that lead toward management and recovery. If there's one thing to take away about treatment, it's this. There is no single magic bullet, not at all. The most effective strategy is almost always what's called a multimodal approach, basically combining different types of therapies to tackle the problem from several angles at once. So, on the psychological side of things, cognitive behavioral therapy, or CBT, has been shown to be incredibly effective. It's all about learning to identify and then change the specific thought patterns and behaviors that feed that cycle of panic. Broader psychotherapy can also be a huge help, giving you a space to explore any underlying stress or experiences that might be contributing. And then you've got medication, where different drugs do very different jobs. You have things like SSRIs, which are for long-term management, though it's good to know they can sometimes make anxiety a little worse right at the beginning. For that immediate short-term relief during an attack, there are benzodiazepines, but they're definitely not a long-term fix. And then you have drugs like propranolol, which are really interesting because they specifically target the physical symptoms, like a racing heart, in situations where you know you might get anxious.
But look, knowing what treatments to use is only half the story. It is just as critical to know what treatments are specifically not right for managing an immediate attack.
And that treatment is antipsychotics. The sources are really clear on this one. Despite how intense and out of control a panic attack can feel, this class of medication is not an appropriate treatment for immediate management. That is a really crucial distinction for getting proper care. And so this is where we'll end it. The journey of managing panic disorder, it's about so much more than just stopping the attacks. It's really a profound process of recalibrating the relationship you have with your own body. And it leaves us with this final, really important question. If your body's alarm system can be faulty, how do you learn to trust yourself again?